My overall passion is, I think, wellness and whole care medicine. That's something that I became passionate about after I received my cancer diagnosis when I was 30 years old. That was an interesting part in my life where my youngest my youngest child, I have a daughter and a son, was 6 months old when I received that dreaded phone call that I'm sure nobody ever wants to hear from your physician, where you're like, oh, so we received the biopsy results, and yes, it is malignant. And you go like, my whole world kind of stopped at that moment.
Right.
The only thing I remember about that, it was like I was holding on to the kitchen counter and I was trying not to like still kind of hold it all together and like, as a clinician, my mind went into the mode of like, what do we do next? Like, what's the next step? We do this, we do that, we do this, we do that. And the reason why I don't celebrate Valentine's Day, even though it was yesterday, was because my cancer surgery was on February 14th.
Wow.
So I just kind of wrote off that holiday out of my calendar. I was like, yeah, no, that's not something I really want to remember. Thank you, but no, thank you. And being put into the system of a traditional, my surgeon was fantastic. I went through the Seattle Care Alliance and had my surgery done at University of Washington. And I can't say that there was anything wrong with my surgeon or with anyone who was taking care of me at a time, but what I got to experience firsthand was the flavor of Western medicine that deals solely with, here's a surgery, here's a medication, we can't offer you anything else.
Right.
And in my eyes was, well, I received my diagnosis before I even turned 30. I was 29 and a half. And I pretty much ate decently most of my life. I exercised majority of my life. Like, why? How did this happen? And no one could give me any answers or even turn me into any direction that would lead to any sort of health or wellness for myself and my family. As I can imagine, being a very young mother of 2 children at a time, it was scary as hell to go through that ordeal. When you're sighting on the dot of like, and I remember talking to an anesthesiologist who came into my room and he was like, kind of, trying to be positive, and I'll be an anesthesiologist and, everything is going to be fine. And I'm like, yeah. And I'm trying to joke with him. I'm like, I would be so much happier if I was scrubbing in with you on the side of working with you rather than be put under.
Being the patient.
Yeah, with you. So that kind of, and also as a patient in that position, it left me sort of feeling very powerless because you can't really control anything. You're just kind of put through the mill of this is what we do. This is how this works. This is how it's going to go down. And I think that sort of opened up this passion inside of me as far as like, I like to empower people that I work with so they can start taking control of whether it's the way they provide care, whether it's the way they provide, whether it provides their income at the end of the day, whether it helps them to empower their patients to take better care of themselves. This is where Juice Plus comes in. Because that stuff is like, I call them like my little magic capsules every single day. And sort of like researching the avenues of what else can we do outside of the traditional model of where we put power into the person who maybe wants to do something different as far as provide care or research other avenues of that are sort of outside, I guess, the traditional mold.